So the next portion of the mouth is the tongue. The tongue is a remarkably sensitive organ. It can churn the food, move around, and still not be bit by the teeth. So the main role of the tongue is to manipulate food between the teeth, and it also has taste buds to it's for determining the taste and texture of food. And the tongue is made of stratified squamous epithelium, and these bumps on the tongue are known as papillae. So these little bumps are the papillae, and these are the sites of taste buds. So different regions of the tongue have different sensors for sensing different tastes. So the front of the tongue is known as the body, and the back region of the tongue is known as the root. The root goes pretty deep, and epiglottis is the flap that is made up of elastic tissue, and it basically closes the trachea and laryngeal region just to prevent food from entering into the respiratory tract. Now, this is a frontal section of the anterior view. The hyoid bone is the bone that you see moving in the front when you gulp food. So this bone is not directly attached to any other bone. You see the submandibular gland over here, the sublingual gland, and you see the buccinator muscle that helps us chew. So if you look at the side of the face or the lateral view of the face, you can see the buccinator muscle. And the next portion of the mouth is the teeth. Now we have 32 teeth. We have incisors in the front that help in biting and tearing. And then you have the canine in the pointed teeth that help in tearing food. And then you have the premolars, which help in chewing, and the molars that help in chewing. Now, in baby, there are only 20 teeth, and the periodontal ligament is the ligament that holds the tooth in the socket. So this ligament forms specialized joints known as gymphosis of the teeth. So this is called the gymphosis of the teeth. So gymphosis of the teeth is the teeth joint between the gum and the teeth. Now the wisdom teeth are called the third molars, and the wisdom teeth basically erupt when the maxilla and mandible elongate to accommodate them. The reason why we have so many problems with the wisdom teeth is that over time human face has become more flattened and the maxilla and mandible have shortened. So this change has not left enough room for accommodating the third molars that we call wisdom teeth. So the mouth has several functions. It helps in mechanical digestion because the tongue and teeth help in chewing the food. And this is where we begin chemical digestion in the presence of water and saliva. And we also have defensins in the mouth that are antibacterial, so they prevent any infection by bacteria as much possible. And the tongue helps in manipulating the food and chewing down the food and moistening the food before we gulp it down the esophagus. Now, the teeth, salivary gland, and tongue are very important in contributing to the function of the mouth. Now, if you look at the mouth, you have the uvula. So this little structure that you're seeing is called uvula, and right above the uvula is the hard bony palate, and below the uvula But right next to the uvula, you have the soft palate. Now, the palate separates the oral cavity from the nasal cavity, and that's why it is possible to breathe while we are chewing food. And the mouth, or the hard and soft palate, specifically contain a very thin layer of mucous membranes that keep the mouth moisturized at all time. And this little projection that you see is a conical projection that you see when you open the mouth wide and you ask somebody to hold the tongue out. The uvula is a little structure that hangs out from the roof of the mouth, specifically the soft palate region. So this uvula is very clearly visible when somebody opens the mouth and holds the tongue out. And all the teeth together are called dentition. So they basically help in mastication of the food. One of the major structures in the mouth is the soft palate. So the soft palate is the structure at the back region right next to the uvula towards the neck. Soft palate is only made of muscle and it prevents food from entering the nasal cavity. So the soft palate and hard palate together serve as a good separation of the oral cavity from the nasal cavity. Now, when bacteria gets trapped in the teeth and they produce acid, it basically erodes the enamel, causing tooth decay. And when the food gets deposited, it's basically called plaque. And the bacteria is invisible in the layer of plaque, but it constantly houses in the plaques in between the teeth, and they secrete mucus and they continue to grow. So if you have too much plaque in the teeth, it promotes tooth decay sooner or later. So it's always a good idea to clean up the plaque from time to time. Now, other disease associated with the oral cavity is gingivitis. Now, gingivitis is basically the inflammation of the gums. Usually, gingivitis is followed by periodontitis. Periodontitis is gum disease, whereas gingivitis is just the inflammation of the gums. Now, periodontitis is also caused due to deposition of bacteria and deeper infection into the gums. So eventually, when gingivitis progresses into periodontitis, the tooth may become loose and people might, develop a deeper gum infection. So the next region of the mouth is the pharynx. We have already talked about the pharynx in the respiratory tract. So by now you should be aware that you have 3 regions of the pharynx: the nasopharynx, oropharynx, and the laryngopharynx. Now the nasal pharynx is a region in the upper respiratory tract, so it's really not involved in digestion. The main function of the pharynx is swallowing. In scientific terms, swallowing is called degglutination. So the pharynx itself is made up of skeletal muscles that help us swallow food forcibly down. So if you want, if you have some food that's in your throat or in the oral cavity, you can actually force it down into the esophagus. So that is done by skeletal muscles. So there's 2 groups of skeletal muscles in there that help in swallowing of the food. And the pharynx that is involved in degglutination is actually oropharynx and laryngopharynx. So you can see that the pharynx is right over here. So this region above is the nasopharynx. The region that connected to the oral cavity is the oropharynx, and right under the oropharynx there is a laryngopharynx. So the pharynx connects the oral cavity to the esophagus, and it also connects the nasal cavity to the larynx. So swallowing food involves two stages. One is the voluntary stage and the other one is an involuntary stage over which we have no control. Now, the skeletal muscles in the pharynx are involved in voluntary stages because if we want to swallow some food from the mouth, we can. So that is the voluntary component where the tongue pushes the bolus into the pharynx. And then you have the involuntary phase. The involuntary phase, the soft palate basically prevents the food from entering the nasal cavity, and we do not control that. So that's an involuntary phase. And once we push the food down, the larynx moves up and causes epiglottis to cover the glottis. So the trachea gets covered and it prevents the food from entering the respiratory tract. So now you can see that during the involuntary phase, the epiglottis closes the opening of the trachea. This opening, the epiglottis itself is made up of elastic tissue, and that elastic tissue just shuts close the opening of the trachea to prevent food from entering the respiratory tract. So the process of swallowing can be divided into three phases. The first one is the oral phase. Oral phase is the voluntary phase that we just talked about. So you form a bolus in the presence of saliva and a lot of water in the mouth, and you swallow it. The next phase is the pharyngeal phase. The pharyngeal phase is an involuntary phase, and this begins when the food touches the receptors of the laryngopharynx. So the laryngopharynx has certain receptors that activate the involuntary process, and the soft palate in the tongue blocks the food from entering the nasal cavity. At the same time, the larynx pulls up the epiglottis, and this flap closes the opening of the trachea to make sure the food is pushed down the esophagus. So at the same time, the pharyngeal muscles, which are mostly skeletal muscles, they contract and they help in pushing food down the esophagus. And at this point, when you're trying to swallow the food, you cannot breathe. So once you're swallowing food, you stop breathing momentarily. And the third stage is the esophageal stage. This is also an involuntary stage where the esophagus performs peristalsis. So the esophagus on the top part has a mixture of skeletal and smooth and elastic tissues, but in the bottom, as we go down towards the stomach, it has mostly smooth muscles which are controlled by the brainstem and the enteric nervous system that is present in the esophagus. So once the food is pushed down the esophagus, it's followed by an involuntary wave of smooth muscle that we call peristalsis. Now the peristalsis pushes food down the esophagus, and the first wave of peristalsis is followed by a second wave of peristalsis to make sure that all the food has been pushed down the esophagus. Now, when the food reaches the stomach, so this opening is controlled by sphincter muscles that you call the cardiac orifice or the cardiac sphincter. It's called the cardiac sphincter with respect to its proximity to heart, but it has nothing to do with the opening of the heart itself. So you call it the cardiac sphincter between the stomach and the esophagus. So when the bolus reaches the stomach, the sphincter muscle relaxes to allow the food to enter the stomach. And once the food has entered the stomach, it closes to make sure we don't regurgitate any stomach acids into the esophagus. So the esophagus is approximately 10 inches long, and it has to pass through the diaphragm, and the opening through which it passes through is called the esophageal hiatus. So this opening right over here in the diaphragm is called the esophageal hiatus. And the cardiac sphincter itself, which is right over here, can contribute to acid reflux or heartburn. So heartburn itself has nothing to do with the heart itself, but a heartburn is the regurgitation of stomach acids into the esophagus and the sensation of burn that follows after it. Now the upper esophageal muscles, as we talked about, right over here you have a mixture of smooth and skeletal muscle, but as you go down the esophagus you only have smooth muscles to perform peristalsis and control swallowing. So the esophagus itself has no role in mechanical or chemical digestion, but all it does is provide a pathway for food to enter the stomach from the oral cavity. So this is another picture that shows peristalsis in the esophagus. So this is the first wave of contraction pushing the food down, and then the first wave is followed by a second wave of contraction to ensure the food is pushed down. The opening is called the cardiac sphincter or the cardiac orifice. So during this process where food is put down, there is no mechanical or chemical digestion taking place in the stomach.